Hi, today I'm going to demonstrate joint mobilization for the shoulder, the elbow, and the wrist. While doing this procedure, make sure that the therapist follows the proper body mechanics to prevent injury. And at the same time, also drape the patient so that the patient is of comfort and you also protect his or her privacy. So for the shoulder joint or the glenohumeral joint, we are going to mobilize the humeral head against the glenoid fossa of the scapula. So before I would perform the inferior glide of the shoulder, I would perform a humeral head distraction first. So I would perform a grade 2 distraction while the shoulder is positioned in the loose pack position. So the patient is in supine, well rested, and one hand will be on the distal part of the humerus and the mobilization hand will be on the proximal part of the humerus. So I'm going to perform a grade 2 distraction, and when I determine where the limit is, that is where I'm going to perform my grade 4. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again, it should be small amplitude motions, and this inferior glide or caudal glide is supposed to increase shoulder abduction. So you can also do it this way in a different position. The other hand stays the same, but the other one caps over here, and you would perform an inferior glide as well, going this way. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Alright, so the next thing we're going to do is a glenohumeral head posterior glide. So this motion is going to increase shoulder flexion and internal rotation. So the therapist will be in between the patient's arm and the patient's lateral side of the body. And one hand will be over here on the distal part of the humerus, and the other hand will be on the anterior superior part of the humerus. So the first thing that I really prefer to do is perform a grade 2 distraction first on the loose pack position, and when I determine the limit of it, that is where I'm going to do a posterior glide. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So another alternative position for this one is putting the patient's hand across over the opposite shoulder with the therapist's hand over here. The hand on the proximal part of the humerus is going to pull the glenoid towards the therapist or towards me, and my top hand is going to perform the posterior glide for the shoulder downwards over here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Next is the glenohumeral joint anterior glide. This grade 4 mobilization that I'm going to perform is aimed to increase shoulder external rotation. So in order to efficiently do this mobilization, have the patient in the prone position. In the event that we don't have any mobilization board or wedge, we can have a folded towel that is placed on the anterior aspect of the patient's proximal chest on the anterior clavicle. So one hand, the therapist's hand, is holding on to the distal part of the humerus right here, and then the other hand will be providing mobilization on the posterior surface of the humerus right here. So after achieving the loose pack position for this one and performing a grade 2 distraction, that is when I'm going to perform my grade 4 mobilization. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Alright, for the last mobilization for the shoulder, I am going to perform a superior glide for the scapula at the scapulothoracic joint. So this is aimed to increase the scapular movements and to improve the general shoulder range of motion. So one hand right here is going to scoop over or around the inferior angle of the scapula right here, and then the proximal hand will be holding on the acromion process area of the scapula. So the mobilization, since you are going to mobilize superiorly going to the cranial part of the patient's body, you are going to mobilize coming from here where you scooped your hand on the inferior angle. So this direction is also going to aid 3, 4, 5, 6, 7, 8, 9, 10. It is going to aid with shoulder flexion, abduction, and external rotation. Okay, so I'm going to do another set. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now let's move on for the elbow. So the first thing that I'm going to perform is to apply a grade 2 humero-ulnar distraction for pain control for 10 oscillations for 2 sets. So the patient's arm is positioned this way, using a gait belt to stabilize the distal part of the humerus, and then both hands cupping against or around the proximal part of the forearm. So the distraction direction will be towards this way or inferiorly. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again, for grade 2, you are going to perform large amplitude motions within the range without pain. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So if the pain is tolerable enough, we can progress to grade 3 for the humero-ulnar distal glide to increase elbow flexion. So with the hand placements maintained, you're going to perform a scooping motion. As the scooping motion is going to increase the patient's elbow flexion. So it's going to be 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So the grade 3 mobilization is large amplitude motion up to the limit of the available range. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So the humeroradial anterior glide is going to help increase elbow flexion range of motion. So the therapist's hand is going to cup on the patient's elbow with the thumb holding on to the radial head, palpating on the radial head of the patient's elbow, and then the other hand is going to stabilize over the ulna. So I'm going to perform an anterior or a volar glide for this one. So it's gonna be 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So I am performing a grade 3 over here in order to increase elbow flexion. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So last is for the wrist. So the patient's hand is positioned this way with a rolled towel on the forearm, with a stabilizing hand over the distal part of the forearm, and then the mobilizing hand is on the patient's hand. So the distraction is going this way. So I will provide a grade 2 distraction in order to know where the limit is. So distraction. So when you get where the limit is, that is where you're going to perform a grade 4 mobilization. So the first mobilization that I'm going to perform is a posterior glide of the radiocarpal joint to increase wrist flexion. So the motion is going this way or dorsally. So distraction, grade 2, and then grade 4 posterior glide. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again, this is small amplitude motions at the limit of the available range. Distraction: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then for the anterior glides, I'm going to perform this at the same joint, on the radiocarpal joint, in order to increase wrist extension. So you are going to maintain the patient's hand position this way, and the therapist's hand position this way. But the difference is you are going to perform a volar glide going this way anteriorly in order to increase wrist extension. So I'm going to perform a grade 2 distraction and then my grade 4. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So finally, I'm going to perform an ulnar glide for the radiocarpal joint. So you are going to position the patient's hand this way, and for the ulnar glide, you are going to perform the mobilization this way towards the ulna. So it's going to be 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The ulnar glide is done to increase radial deviation, which is needed for efficient wrist extension. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So there goes my joint mobilization demonstration for the shoulder, elbow, and wrist. I thank Brooke and Cindy, and especially you, for your time to watch and learn. Have a good day.